Anderson, I'm trying to help New Yorkers recognize that it's going to get a lot worse before it gets better. And I definitely want to talk to you about that shelter-in-place idea, which is basically the model you see in San Francisco right now. But even beyond that, what I'm really deeply concerned about is medical supplies. And then beyond that, even other basic supplies that people need in their lives. But the medical supply situation, Anderson, you're talking about ventilators, surgical masks, surgical gowns, really basic stuff that we're deeply concerned about where we're going to be in a few weeks. And here's the problem. The federal government is absent in this discussion right now. President Trump at this point is the Herbert Hoover of his generation. There's a massive national crisis going on, and he is consistently late and very marginal in what he does. He's taking actions that are far, far behind the curve and aren't addressing the core concerns. I'm talking about a massive number of new cases we expect of coronavirus. We're almost to 2,000 cases right now in New York City alone. That's going to cause a surge into our hospitals. They are going to be using up their supplies rapidly in an unprecedented manner. We've been appealing to the federal government to get us a resupply, and President Trump has not done anything to maximize the amount of medical supplies being produced and to ensure they're distributed where they're needed the most in the United States. There are some products I'm worried about that it could be as soon as that. And I mean, looking at this surge, I mean, Anderson, yesterday we saw a jump of 100 cases. Today we saw a jump of hundreds of cases, almost a doubling overnight. Over 1,800 now, pushing 2,000 cases in just this city. And where this rate is just going to keep increasing. I talked to the head of our public health system, Dr. Mitch Katz. He's got enough supplies for the immediate future, but you're talking about a massive surge in demand. And we have been appealing constantly to the federal government to start a supply system that will actually help our hospitals survive an unprecedented surge in cases. This is the problem. Hospitals are going to have massive new demands, and things like surgical masks, you just burn through those in a normal day, let alone in an emergency. I want to answer that, and Governor Cuomo and I spoke a few hours ago, Anderson. Just one more point on the supplies and all. I just want to emphasize, President Trump has to mobilize the United States military to fully act in the coronavirus situation. I do. I want their medical teams, which are first rate. I want their logistical support. I want their ability to get stuff from factories all over the country where they're needed most. The only force in America that can do that effectively and quickly is the United States military. And they're being sidelined right now by Donald Trump when he should be calling them to the front. This is the front right now. I am talking about the United States military going where they can save the most lives of Americans. And that's places like New York and Seattle and California. And soon it's going to be a lot of other places. Why are they building a wall, and why are they at their bases when they're needed right now? They're ready to go. The military's ready to go. The president needs to give them. And what it means, look, the best example, Anderson, is San Francisco right now, and that area of California, millions of people. That is a smart order. I urge every American to look at what San Francisco is doing. I think that's where it's going to be going for a lot of us. It's very clear rules about staying home with only minimal activity. Get rid of all non-essential work, and I mean, again, horrible human consequences in terms of people's livelihoods, but necessary to slow down the growth of this disease. It's a smart plan. That's where I think we should go. I talked to the governor a couple of hours ago. He and I had a good conversation. We're going to have a further conversation. He is trying to think about the needs of the whole state and how to balance each strategy. I respect that. But I do think we share urgency, and we're working together on a common approach.